Step 27, timing of trigger. So egg quantity, egg quality, egg maturity are one of the most important factors in determining your success in IVF. So quantity, quality and maturity of your eggs depends on two big group of factors. One is linked to yourself as a patient and the second is linked to your treatment. So in terms of your factors, your age, your egg reserve, and how many antral follicles you have at the time of starting stimulation, and accessibility of your ovaries for ultrasound scan and egg pickup are the important factors which determine your egg quantity, quality, and maturity. In terms of treatment factors, type of FSH drugs, dose of FSH drugs, trigger type, trigger dose, timing of your trigger, and egg collection practitioner skills and experience are most important defining factors. So you can see from here the trigger timing is very critical, because if you trigger too early you get a lot of immature eggs and a lot of poor quality eggs. If you trigger too late you have a lot of over matured and degenerated eggs, and they will be of poor quality and quantity. So and that's why deciding exactly when you should trigger for maturation is very important. So let us say you started your IVF treatment. After your period you started your stimulation injections. Approximately after 7 days or so you will come for first blood test and scan to monitor how your ovary is responding, to check if you're ready for the trigger. So on ultrasound scan, sonographer checks counts number of follicles you have on each ovary and size of all those follicles. So once leading follicles reach certain size, then your specialist decides to do the trigger. So in terms of timing, there are two different strategies. One is a standard timing and the second is individualized timing. I prefer individualized timing. In standard timing, for example, if you have more than one 18mm follicle or more than two 17mm follicles, leading follicles, then you assume that all the follicles are ready for the trigger and you give a trigger shot, then do egg collection after 36-37 hours after the trigger. So that may not be always best way of triggering. For example, I will give you this example. This patient had a first ultrasound scan on day 7. She had lots of small follicles. Then they repeated the scan after 3 days. Let us say on Monday on day 10. You can see there's one follicle larger than 18mm. If you use a standard trigger, you just trigger and probably you get maybe 3 mature eggs, because follicles should be approximately between 14 to 20mm to enter the maturation stage. So if you do individualized trigger, then if you continue the stimulation another few days, another couple of days, you can see that here more follicles entered maturation stage, maybe 4 follicles entered maturation stage. Yes, you will lose the leading follicle, it's more than 20mm, then still you should get 5 mature eggs, because doesn't matter whether this is leading follicle or a smaller follicle which will become larger follicle later. These follicles have a very similar chance of being high quality. So just the follicles need to be right size before the triggering. So individualized trigger, different specialists have a different strategies depending on the experience in terms of deciding what is the right time for the trigger. I have developed my own chart for that, and then I will follow this strategy. So I developed this folliculogram where I categorize the response to stimulation into 5 big categories. So let us say at the beginning of your stimulation, on the first day of your FSH injection, on the let us say second or third day of menstrual period, all follicles are small. They are less than 10mm, which means they are antral follicles. They haven't gone into maturation stage, growth stage. So after the stimulation, approximately 6-7 days after the stimulation, the number of follicles should grow and become larger than 10mm. So they've been activated, and then you do ultrasound scan and chart them on something called folliculogram. So when you chart them, you can see 5 different patterns. Okay, so the first one is a rectangular response. This happens if you have lots of follicles on your ovaries, and a lot of leading follicles respond equally. And when you do scan, first scan or second scan, let us say first scan you did on day 7, second scan on day 9, you see this chart. All these follicles, there are a lot of small follicles which measures less than 10 centimeters. Then all other follicles are distribution across the chart equally. So the here leading follicle is 20 millimeters, and there's a lot of follicles in different measurements. This is really ideal. So in here, if you see good number of follicles which is between 14 to 20 millimeters, then you can pretty much trigger and get a good result. Second type of response you see rectangular, which means in the pool a lot of leading follicles responded very well, and they all entered the maturation stage, and a lot of tiny follicles less than 10 millimeters, which are not important in that cycle, because we are not expecting to get eggs from them, but actually a lot of follicles responded well, and then you can trigger once a good number of them entered 14-20 millimeter stage. So that's also quite easy decision to make. Then third type of response is a diamond shaped response, which means you have a good pool of follicles and a lot of tiny follicles. When you scan on day 7 or day 9 or day 10, a lot of tiny follicles, then few follicles which rushed ahead. So if you use a standard protocol, you just trigger too early, because you trigger for these leading follicles and you make a low number of, let us say, 4 eggs, which is very low. But in this diamond type of response, if you wait a little longer, maybe a couple of more days, and repeat the scan, you will see these follicles enter the maturation stage, and you should trigger for these follicles. Let these 3 leading ones go. So, and the hourglass response, where you have a low egg reserve, you often see some leading follicles rush ahead. Why? Because at the time of stimulation, they were larger than other follicles, and they had a lot of receptors and responded very quickly to your FSH drug, and within 7 days they entered 7-8 days they entered maturation stage. And then you have a lagging follicles, which may be bigger pool. If this happens, then you should really let these leading ones go, then wait for this next cohort of follicles to enter that maturation stage 14 to 20 millimeters and trigger for these follicles. Kind of you sacrificing these 3 and to get bigger pool of mature and healthy eggs. So the next one is a linear response. This can happen when you have very, very poor ovarian reserve. Let us say here you have got total number of follicles 9. That's very small, and because number is so small, all follicles responding very well, but the actual number is low. Here you can simply trigger for this leading 3, because remaining pool is also small. You're not going to get any more than that, so you may as well trigger for the leading ones. Actually, how many follicles you have on your ovaries and how they respond also depends on when these follicles were activated 3 months preceding to IVF, whether they were activated at the same rate, or you had a burst of activation of few follicles, and after 4 or 5 days then next cohort. Because when you start the stimulation drug on the first day of your stimulation, so the larger follicles, which are close to 10 millimeters, have a full set of receptors and they're ready for response, and smaller ones not. So yeah, that's random. So this is a randomness linked to your IVF. In IVF, a lot of things we can control during treatment, and a lot of things we cannot control. You cannot control. There's a randomness inbuilt in each stage of IVF. That's we call lag factor. So so these are the charts you can utilize. And also individualization means taking into account how you responded in previous IVF cycles. Your specialist looks through your previous cycles and decide whether you should be triggered a little bit earlier than other women, or a little bit later, or average. So most women have a similar maturation regarding to their follicle size, but in some women they need to have a larger follicles for the triggering. Some women need smaller follicles for triggering. That's called individual variation. Like anything in life varies, like in terms of maturation of follicles against the size, also varies between the patients. So that we can find out after analyzing previous IVF treatment cycles. So trigger timing is very critical in determination of egg quantity, egg quality, and egg maturation. It doesn't determine everything, but that's one of the most important factors.